lose a child. Not did I just say a woman? I saw women lose their children. A child died in front of me. I don't know.
I feel like most of all of these deaths, okay, let me not say most, but a few of them can actually be preventable if you have a better working system. Like recently, and Dr. Kenny, you're shaking your head. So you don't think that it's preventable? Like a few of these deaths are preventable?
A
lot of these things happen because people are not.
They don't show up to the hospital on time.
So another child at time.
But it's the same system because we are not even able to even get to the hospital on time. Imagine Bola if we had a working emergency that could have come pick her up earlier.
A lot of people still believe in traditional
methods.
Yeah,
tried all their traditional
Dr. Kenny, that is there. We have that. I'm not going to. There are people who they know that there is healthcare, but they are choosing to not use medical healthcare. But I feel like there are people who want to use it, but exactly apart from just the expense, even getting to the hospital. I remember that I'm watching this new Amsterdam series, and it's a medical series, so I've been having lots of debates surrounding healthcare system, and I feel like New Amsterdam is a bit exaggerated because in the hospital
the medical series are always exaggerated.
they feel like they can help everybody, and I feel like it's not possible. There will be deaths, not due to negligence or anything, but it's bound to happen. So most times I see each of the doctors, they are emotionally invested on each patient, and I'm like, it doesn't work that way, because that's why most times they don't let doctors treat relatives, because
true,
they don't want emotions to get in the way of it. And you as a doctor, you're not getting emotionally invested in your patient, trying to he's homeless and that's why he's always coming back with foot infections, and because of that you want to try and get him a place and all that. How many patients can you actively do this for? How many patients can you actually even care for?
And when they realize that you've done that for one person, the others will keep coming back.
And this is a medical system. It is always almost overwhelmed. Do you get?
This
so
same thing
you don't have time to come and start saying you want to solve exactly an entire problem of a patient. Is almost impossible.
This same thing happened when I was on admission. The lady that was right beside me, I think she lost her baby too, but they couldn't discharge her because she had some bills to pay and she needed to donate blood, because normally in the Nigerian system, I don't know if it's everywhere, but I know that when they give you blood, you have to donate. Somebody has to come and donate for you to replace the one that you collected. So there was nobody to replace the one she collected, and she even still had, guess how much her bill was? Like I think 15 to 19,000 naira, and she couldn't pay it.
Before she went, I didn't tell you, she had to carry back to the ground hospital.
So that doctor that promised I was going to pay her bills, what happened?
Before she left, I saw her in the clinic. She begging me to leave her.
But the truth is, I still feel that a few of these cases, a few of these deaths, Dr. Kenny doesn't agree with me. But okay, so a friend of mine this week was telling me how he lost his best friend. She had, I think it was an issue with a thyroid or something. She just had a swollen neck. And
that was what she had too.
She had a swollen neck and she went to St. Nicholas. And I think the surgery was about maybe 1.5 million.
You see those ones. You see the reason why. Why I don't like to hear these things. Why they are kind of irritated to my ears. Because
they chose to
go to a private hospital.
Okay.
General hospitals are usually more affordable, and I still believe to you, not because my husband is a doctor or because my husband works in a public sector. I still just believe that general hospitals have the best doctors.
Sometimes we feel like
I said earlier,
even those doctors, because most of them are unpaid and they are even underpaid. A few of them,
I don't think private doctors are even underpaid as like that of public doctors.
I feel like.
Are you kidding me?
Okay, wait. Let me
tell you the reason why I still prefer
a public hospital
any day, anytime. Like I said earlier, I fell sick a lot while growing up, and most of the time, especially when I was in Unilag, most of the time I was in loop. If they admit you in Lut, you are going there for maybe just for a stomach problem. You're supposed to see a gastro doctor or whatever. But probably you're supposed to be in a gastro clinic. The minute you complain of headache, a neuro doctor will come that has to do with it. The minute you complain of something else, and it's not just one person. Different consultants are seeing you, and it's not even the same consultant.
But do you know how long it will take for you to see the consultant?
No, they come to you themselves. Calm down. Wait, they come
most
to
of
you
the time.
themselves.
Most of the time,
public sector is actually very stressful.
Most of the time, Bola went to Lut. It was an emergency. So usually they would treat you as an emergency case.
At times when I slept outside Lut. There was a particular time I was in the ambulance for more than 24 hours. I've gone to Lut
several times, and you see people waiting.
That's what I'm saying. It has happened to me too. There was a time I was wheeled into emergency, and I had to sleep in the ambulance for more than 24 hours because there was no bed in the hospital.
You see?
So it has happened to me before. What I'm saying is that so that one is not on the doctors. It is not on it is on the system.
Exactly. I'm not blaming doctors. No, I am not blaming doctors. I am not blaming doctors. I feel like a few of it I may blame it on the doctors, but usually I feel like the negligence on the part of the doctors is because most of them are underpaid. And most times the salary do not even come on time. That is aside. But that is not even our major problem in the health system.
Most people feel that the reason why they should go to the private sector is because they believe that public hospitals are usually more stressful.
Exactly. You have to wait for your turn.
And then why are you complaining about paying 1 million naira?
Calm down. Now let me finish my gist about this.
Something that you probably not even
went to calm down now.
So
she got to St. Nicholas and she had to pay either £1 million or a 1.2 or something. And at the time it was crossover. It was 31st, and it was almost like midnight. They could not go to the bank to withdraw, and I think you cannot transfer that amount. And she said, okay, I will transfer 500 start, and I would we'll pay the balance by tomorrow when we can do another transfer and all of that. And it's midnight. How many people can you source at that point to raise that kind of money?
Was it an emergency issue?
Yes, she could actually afford it, but as at that moment she just couldn't make the payment, and they said no, and the girl died. Now when my friend told me this, I'm like,
in as much as
I'm like, I really cannot blame the doctor, because there are several people that will promise to pay and end up not paying.
Yes. I feel like
in this case she would have genuinely paid, but there are several cases when she would have.
This one has to do with the system in that hospital. It shouldn't be done. It shouldn't be done anywhere. But
initially this was my take. But if you want to treat every patient based on what the patient is saying, I will pay tomorrow. How many people will actually pay?
Calm down. I'm not asking you to treat patients based on sentiment or whatever they say. All I'm saying is that they don't deserve to die because they cannot afford to pay their hospital bills. The highest you can do.
Exactly.
The highest you can. I've seen cases where there was a time I was in the hospital and they brought in a man that was stabbed around, I think, 12 a.m.
And at that point they're asking you bring police report.
Or pay so amount. No. Oshutuyi.
That's very wrong.
That's what I'm saying. It shouldn't be done.
I don't care about police reports. I don't care.
That is you.
That's what I'm saying.
But you know that some hospitals will say it is a policy to get police reports first.
That is what I'm saying.
So many deaths that could have been prevented.
The only time I can say that maybe they should bring police report, maybe it has to do with a gunshot wound.
Even several gunshot wound. You treat the person. You can afterwards, cuff the person to bed and everything.
Exactly what I'm saying. That's the reason why that person died.
You pick up somebody from the road, they are saying who will pay for this person.
It has to do with the system of that hospital. Do you understand?
You have to pay. But even if I found someone lifeless on the road, am I supposed to pay for that person?
Is the hospital supposed to pay for that?
That's what I'm not saying the hospital. That's what I'm saying, that there is an issue with the system.
Exactly.
There should be something that should care for
system in place.
Exactly, should care for things like this. It makes no sense.
So hospitals run on
the money that you bring in and you pay.
You cannot keep saying every emergency that comes in, we treat them and then pay later. What do you think?
Exactly. That's what I'm saying. You cannot treat based on I will pay tomorrow. Yeah, but I still feel like there's something that could have been done, to make sure that they could have still saved the girl, and still, I don't know, but I still feel like there is a whole lot to do in our system. A whole lot.
So health insurance, in places where things work, you
How
walk
many
up-
people
walk
have
on the
health
road with
insurance?
your health
People don't even
insurance.
take that thing
So
seriously.
even if there's health insurance, it's just that it's stupid.
When I was in Unilag, I had an health insurance all through, and that was one of the
Yeah.
things that helped me scale. Yes, that was one of that was one of the
you
things
walk
that
around with
helped
your
my
card so that if,
helped my
if you're
health.
involved in an accident, they take out your wallet.
That was one of the things
But-
that helped my
but
health
the
when I
truth
was
is
in
that-
Unilag, because I remember doing MRI scan like twice, and it cost a lot.
MRI scan is usually a lot.
I'm telling you, I think I did MRI. I did endoscopy
I remember
like
one time
twice.
I had migraine. They told me
And-
to do
and the
MRI
funny thing
scan.
was that
100K. Oh boy, the migraine head it and left though.
my health insurance actually covered every penny, and I remember doing endoscopy twice in Lut, and my health insurance covered it.
But it is really sad. It doesn't even look like. I thought COVID would be like the waking up, the awakening for Nigerian healthcare system. It seemed so because several organizations were beginning to donate to healthcare, but it's like
You know what?
nothing
Exactly
happened.
that money was actually.
It's
going
like
to-
nothing happened. COVID should have been a wake up call. You know, at that point, you cannot even escape and say you want to go abroad
I think
for
the issue-
a working healthcare
the issue-
system.
the
So
issue-
fix it here.
I think the issue is just basically the system.
The
The
system.
healthcare
That's
system.
actually
I
the
remember.
main issue.
I remember the day before I was discharged. They brought in a woman. I think she was 32 weeks gone, and I think they said, according to them, the placenta had already detached from the womb or something, so the baby couldn't. You know, the placenta passes oxygen and food to the baby, and the baby couldn't. So they had to do an emergency CS. You know the reason why? When I had this conversation with my husband, and I still tell him that I feel like the baby could have died. I still feel like the baby could have survived. Yeah, when they brought in that woman,
Okay.
the amount of time they spent trying to prep her, they delayed. At first, when they were at first,
God
they
bless
were
you. This one, will you blame the system? That's what I'm saying. There are some issues that
There's
it
no
is the
way-
system's issue.
there's
Some
no
it is
way-
the hospital. Some it
there's
is
no
if
way-
actually the doctor in
there's no
charge.
way She could have gone into theater without all those things.
Yes, I'm not saying she would have gone into the theater without all those things, but
But
they
you know
wasted
that
too much time
we've
doing
read
those
severally.
things.
We've read severally online of people coming to lament how doctors have wasted their time.
In
They will
that
come and
general
complain, and
hospital,
the doctors will
there's
say
just
no, not yet.
One theater for CS.
Exactly.
And patients in theater. What do you expect? You expect them to carry patients and customers.
So now that's where the system
That
comes into
system
play.
at the hospital safe.
Who is building the hospital?
There's just one theater for.
Who is building the hospital?
Wait, this is a government hospital.
Yes.
We just want theater.
Yes.
Yes.
For CS.
He.
And even if there are more than one, the personnel, I just
It's
need
just
like
one.
2 doctors on call,
Oh my
and they would
goodness.
assist each other.
Anyways, back
There's a lot
to
of-
the.
There's a lot of work to
And
do.
that child would have died anyway. No matter what they do.
But Dr. Kenny, beat your chest and say that there are some deaths in this country that couldn't have been prevented.
How?
So you feel like all of these deaths, none. I don't know if you are saying this because you're a doctor and you feel like with your patients you always try your best, so you do not think that.
I feel like it's the patient's fault most of the time. I don't. It's not the doctor's fault. A lot of times.
I'm not
Yeah,
even
it's
saying the doctor.
This is what happens when you are talking from a doctor's
I'm not-
perspective.
No, I'm
remember
not saying now. I'm not blaming the doctor. I'm just
I'm
saying
not-
that
I'm
these
not ruling
deaths
out-
could they have been
I'm not ruling
preventable.
out incompetence on part of the doctor, but a lot of times these patients are also at fault. There's incompetence on the doctor's side. I've had a prof do MVA for a patient, a prof. She just got a
PhD.
Bill Gates grant
Wow.
this week. A prof did MVA for a patient and knowingly perfected the uterus. She didn't know. And then the following day, stomach started to swell and they had to do a surgery. Like throughout that day, they're doing this. I got to work by 8, so from 8 till we finished that surgery by 11 p.m. So between 8 and 11 p.m. we're doing the investigations and everything, and then we started surgery by about.
But you know they can sue that prof.
It wasn't her fault. There is part of the things that she explained to the patient before the
It
procedure.
can happen.
True, they usually say this.
Yes, she said it to the patient. It's part of the thing. There is risk of perforating your uterus.
Any-
And patients still die. But as a prof, do you think she's incompetent? You know, many she has done over there.
Exactly. I would not say that is.
Well, Sha, this is what happens when you're talking. I remember my husband and I having an argument.
That's a very unique case. I would not say it is.
I remember my husband and I.
Things happen.
I remember my husband and I having an argument when I got better. So remember my second MBA, they told me, "Oh, your service is closed. You're not expected to have any more clots." And then the following weeks, I began to see clots.
You've seen 3 different doctors say 3 different things.
I did a scan, and the scan didn't show anything. And I come back in 1 week time, and you're telling him, yeah, exactly. So what happened there? Because I could have died. I lost a lot of blood. How can a
another
scan,
thing that we usually have is cases of misdiagnosis. Dr. Kenny, whose fault?
So
we have cases of misdiagnosis.
Misdiagnosis is from pure poor.
We're going to be Dr. Kenny on this show.
Never seen like this.
Why now?
Poor skill and incompetence. Now, in your case, most likely poor skill. But like what I explained to you, and what the consultant explained, even when I was in there, all your symptoms at that point in time, correlated. The scanning see something. Exactly. I saw your cervix was closed, and then you're not bleeding again.
Can we say it was a miracle?
So a miracle how?
Doctors don't believe in miracles, so
because at that point in time, everything.
Sometimes what you see exactly makes you come to conclusion.
It didn't make sense anymore.
So
I remember
at that point in time, everything.
So my argument was it made sense the previous week, and the following week it didn't make sense anymore. What happened? So that was when they diagnosed me of having this gestational trophoblastic disease. It's called a molar pregnancy, in a situation whereby you're not actually pregnant with a baby, you're pregnant with a mole. There was a fault from the sperm or whatever, and then I had to do a series of tests. I had to do a series of tests. They call it beta HCG test. The figure started to increase, and the doctor had to refer me to an oncologist. And that was when I joined NLP, and I started to pray. Like I feel like why would a consultant refer me to an oncologist? The first thing that comes to your mind when a consultant refers you to an oncologist is cancer. And then when you have GTD, there are high chances that you can have choriocarcinoma. It's a type of cancer that has to do with the uterus. And then I started to pray, and all of a sudden, do you know that the following weeks the figures started to drop? It went from there was a time I think my first test was about the first figure. Normally the normal reference is 0 to 2. When you do a beta HCG test, normal, if you're not pregnant, the normal reference is supposed to be 0 to 2. So your titers are supposed to be between 0 to 2. Mine was 333.9.
Are you serious?
So that was when the consultant was like, this is very bad, we might have to refer you to an oncologist. Then I started to pray, and then gradually by itself, all of a sudden it started to drop, and then they got to a point where it was 119. Then I think the last one I did was 19. I'm sure the next one I'll go for probably be like 2 or 3. Do you understand? I don't know, but I'm really thankful for.
That's why some people,
at that point I told people that please pray for me. I remember telling some specific set of people that please pray for me. So I feel like medically, spiritually, everything has just come together.
Fight them everywhere.
Spiritually, everything just came together and worked.
I feel like that's why people like to do second opinion. Although it will make you cost double, but I know that sometimes second opinion is usually advisable. Why at the clinic where I used to work before, I remember one girl she went to top diagnostic centers, and they said there was nothing wrong with. They couldn't find anything in her breast. Meanwhile, she was I think she was in a nipple was bringing out water or something, and even our radiologist at the point even checked. I said there was nothing, but the founder of the clinic where I worked, she was in the US at the time, and then she joined. She like joined in virtually, so she's like check here, and then we found it. She could have come to our clinic and leave as well and say there is nothing, and in a few weeks maybe it even degenerate, guess what, and then So I feel like there are times that, especially when you are getting conflicting results, it will cost more, but it's good to get a second opinion. It's good to get, because issues of misdiagnosis, we have it here, especially in this part of the world where, let's say, everybody will, I want to go and see my next patient. Do you get? Dr. Kenny will not agree with me, but I feel that way. No, the past part I said that doctor will do ruling now because he wants to go and meet his next patient. And I looked at his face, Exactly.
I'm just really glad that I actually got better, and I'm still getting better. I'm grateful for
we that we still have like eight more kids to go from here.
See what happened.
8 more kids.
I beg.
Oh my goodness.
Anyways, I still want to have twins. My husband is a twin.
Mado.
But maybe not now. Like I said, after my
not PhD. I don't know what you're talking about. Dr. Kenny, do you agree to this? You don't want anyone this is Dr. Kenny said.
After my PhD,
it can't be. PhD is in like 5 years time.
Yes.
No, please, so that your junior child will not be calling Kewa uncle. We don't want that, guy.
Anyways,
by next year we'll come and ask what's up.
I'm grateful
Dr. Kenny, right?
I'm grateful to my husband, my family members, my friends that stood by me.
Oh my God.
God bless every one of you. I love you.
I love you
too. We hope to see you next. Talks.
Thank you. Please do share your COVID-19 lockdown experience. What happened? All the juicy experience, sad, the good. We'd love to know. Share in the comments. Do not forget to like, subscribe. Oh my God. Bye.